Hey everyone, welcome back. We're diving into a topic today that I think is really relevant to everyone, compassionate care, and specifically how nurses use client education and cultural awareness
Hmm.
to provide that really patient-centered care.
Yeah,
And we've got some fascinating sources lined up for this deep dive, so get ready to, really uncover how to make a difference.
I'm excited to dig into it.
Me too, me
Yeah.
too. And I think it all starts with really understanding how people learn.
Right.
And you might be surprised to know that client education is a huge part of what nurses do.
It is. It is. Nurses are educators.
Yeah.
Whether they're working with, just one person or their families or even
Yeah.
communities, like it's a much bigger scope than people realize.
It really is. It's not just handing someone a pamphlet.
Right. Oh, absolutely not. And our sources really dig into all the ways people learn, breaking it down into three main domains: cognitive, affective, and psychomotor.
Okay, I have to admit, psychomotor, that sounds a little intimidating.
It's a mouthful, right?
It is. Can you break that down for us?
Yeah. So, cognitive learning, that's all about using your brain power, right? Thinking, understanding, and applying information.
Okay.
So, let's say a nurse is teaching a patient, how to recognize the symptoms of hypoglycemia. So, things like feeling dizzy or confused,
Mm.
that's using that cognitive domain.
So it's like absorbing the information, processing it.
Exactly.
Okay, got it. So what about the affective domain? What's that all about?
That's a good one. That's all about the feelings, values, attitudes, the emotional side of things. Like, this is where a nurse might help a patient, say they just got diagnosed with diabetes, and they're
Mhm.
trying to process those feelings. That's the affective domain in action.
So it's recognizing that healthcare isn't just physical, it's emotional too.
Absolutely. It's about the whole person.
Yeah.
And then that brings us to, that psychomotor domain, the one that sounds a little scary, but it's really not.
Okay.
It's all about putting knowledge into action. So think of it like a nurse teaching a patient how to give themselves an insulin injection.
Hmm.
It's hands-on, they're doing it. That's psychomotor.
The doing part, okay, that makes it much easier to understand.
Right. And here's the thing. Often, all three of these are happening at the same time, especially in a healthcare setting.
They're all intertwined. So it's like you're understanding the information, processing your emotions about it, and then also learning the skills to manage it.
Yeah, it's a lot. And that's why it's so important to understand the needs of adult learners specifically.
Right, because we're all adult learners at some point.
Right. At some point, yeah.
Whether we're, trying to learn a new skill for work or dealing with a health challenge, figuring out how to manage a new diagnosis, we're all in that boat.
Absolutely. And it's so different than learning in a classroom. When we were kids, adults need to see why this matters to them. They
Right.
need to be able to connect it to their own lives, their own experiences, good and bad.
And feel empowered to actually use that information.
Exactly.
So how do nurses do that? How do they reach adult learners in a way that really sticks? I know our sources mentioned this thing called teach back.
Oh, teach back is so powerful. Instead of just giving the information, the nurse actually has the patient explain it back.
Oh, interesting.
Yeah, or demonstrate it, so it's not just a one-way street.
It's a two-way conversation.
Exactly. So let's say a patient is prescribed a new medication.
Okay.
The nurse might say, okay, can you walk me through how you would take this at home?
I see.
And that way they can make sure the patient really understands.
It's about making sure the information is really sinking in.
Yes. And it empowers them too. It makes them an active participant in their own health.
Exactly. And that feels so important, to have that ownership over your own well-being. It makes a huge difference. That's so key, that feeling of empowerment. And it makes me think about, how important it is to understand each person's individual experiences, especially in healthcare, and how that ties into this idea of cultural competence.
Absolutely. You can't have patient-centered care without taking culture into account.
Right.
We're all coming from different places. We all have different backgrounds.
Exactly.
And our cultures shape how we see the world, how we experience healthcare, everything.
That's so true. It's not
Yeah.
one size fits all, right?
Not at all. One of our sources talks about Madeline Leininger's theory of culture, care, diversity, and universality, which sounds really complicated. But
Yeah.
basically, it just means that nurses need to be aware of those cultural differences and how they impact care.
Okay, so how do they do that?
Mm.
It seems like it takes more than just good intentions, right?
Right, it's a process. Part of it is understanding the difference between what we call emic and etic knowledge.
Emic and edict, those are words you don't hear every day.
I know, right? But they're important. Think of emic knowledge as the insider's perspective, like the patient's point of view.
Yeah.
So, for example, a patient might have certain beliefs about an illness based on their culture, right?
And EAT acknowledges the more, I guess, clinical perspective.
Exactly. It's what healthcare providers learn from textbooks and research and their training.
Got it.
And the key is to bridge that gap between those two perspectives, to really meet in the middle.
That makes sense. It's like that difference between equality and equity that we hear about.
Yes. Perfect example. Equality is giving everyone the same thing, but equity is making sure everyone gets what they need to succeed, and those needs might be different.
Right. And in healthcare, that might mean recognizing that some communities face more obstacles to good health than others
Exactly. And not treating everyone as if they're starting from the same place.
because they're not.
Right. And that's especially important when we're talking about marginalized communities like the LGBTQIA community.
Absolutely. Because they've historically faced so much discrimination in healthcare, it's crucial to be sensitive to their experiences.
Yes. And make sure they feel safe and heard and respected. And our sources really emphasize that using the right pronouns, understanding their unique needs, it all matters.
It creates that space of trust and respect, which is the foundation of good care, really.
100%. And it all comes back to that idea of patient-centered care, which is what this deep dive is all about, right?
It all ties together, learning how people learn, being aware of our own cultural biases,
Right.
recognizing that every patient is an individual with their own story.
It's about treating the whole person, not just their symptoms.
It really is about seeing the whole person, and that brings us to, I think, the heart of it all, this idea of patient-centered care, which
Yeah.
to me, it feels like such a, I don't know, like a breath of fresh air compared to how healthcare can sometimes feel, impersonal.
It's such a needed shift, moving away from just the clinical side of things
Right.
and really focusing on the patient's experience, their values,
Mm-hmm.
their beliefs, what matters to them.
Absolutely. And one of our sources talks about this theory, Watson's theory of human caring.
Yes.
And it feels so relevant here because it really emphasizes that human connection.
It's essential. And, one thing I think is so interesting about this theory is that it says that nurses need to care for themselves.
Oh, that's so important.
In order to truly care for others, it's like that saying, you can't pour from an empty cup.
Exactly. If you're run down, burnt out,
Right.
you're not going to be able to give the best of yourself to your patients.
Absolutely. And Watson actually outlines these 10, she calls them carry task processes,
Okay.
which are like these guiding principles for human-centered care.
And instead of listing all 10, maybe we could just pick out a couple
Sure.
that really resonate with you, or maybe that folks might not expect.
Yeah, one that always stands out to me is creating a healing environment, which I think a lot of people, when they hear that, they think about,
The physical space.
yeah, like making sure the room is calm and peaceful.
Right.
But it goes deeper than that. It's about creating this space of respect, of genuine listening, where the patient feels safe to open up.
So it's almost like an emotional environment, too.
Exactly. It's about that feeling, that sense of being heard.
Yeah, I can see how that would make a world of difference.
It really does. And another carry task process that I think is so powerful but often overlooked is, are you ready for this?
Hit me.
It's opening to spiritual mystery, unknowns, allowing for miracles.
Whoa, that's a mouthful.
I know, right?
But it's beautiful.
It's about approaching each person with so much humility, recognizing we don't have all the answers.
That there's still so much we don't know.
Exactly. And just honoring the mystery of each individual life and their own unique ability to heal.
Even when things are tough, to stay open to that possibility.
Yes. And that kind of ties into what we were talking about earlier with listening, touch, presence.
Right, because our sources talk about how important those things are, even though they can seem so simple.
They're simple, but they're not easy in a world that's constantly rushing us.
So true.
To slow down, to really listen, to offer a comforting touch. That's powerful.
It's about really being present with someone in that moment.
Yes, and part of that is being attuned to their spiritual needs, which is another thing our sources highlight.
Spiritual assessment, right?
Yes, and it's not always about religion, it's about understanding what gives their life meaning.
What are they drawing strength from?
Exactly, and that can really inform their care in a holistic way.
I love that. And I feel like this conversation, this deep dive, has really taken us on a journey.
It has.
From understanding how people learn, to embracing cultural differences, to really putting the patient at the center of it all.
And we've just scratched the surface. There's so much more to explore here.
Always, always. But I hope this has given our listeners something to think about, maybe even inspire them to bring a little more compassion to their own lives.
Even outside of healthcare, these principles apply everywhere.
That's such a good point. It's about how we treat each other day to day.
Exactly.
Well said. And on that note, thank you all for joining us for this deep dive into compassionate care. And until next time, keep those minds curious and those hearts open.